School photograph. He had a good smile. He was quite cheerful, wasn't he? Most of the time.
He was a happy person.
Yeah.
Michael and Christine Rousell like to remember their son Jason as a child. They fostered him as a baby and soon found out he had a learning disability and struggled to speak. Jason was a kind, funny boy who loved being in the garden. But life changed for Jason when, wanting to leave home and become more independent, his parents asked for help from the local authority.
From the time that he went into care, we could see a deterioration in him physically and mentally. If a vacancy comes up, it seems that they grabbed it, irrespective of whether it was suitable or not.
Jason was sent to 7 different institutions over the next 20 years, finally being sectioned in a secure hospital 150 miles from his family. He was supposed to be at Cedar House, a private hospital paid for by the NHS, to be quickly assessed and moved on. He stayed almost 8 years until his death in January 2018. Jason had stuck a small button battery up his nose, and despite telling staff what he'd done, it took 2 days before he was taken for emergency treatment. He died because of complications after surgery to remove it.
The doctor or the responsible clinician said take him to hospital immediately. When I asked him why they didn't do what he said, was this normal? And he said, well, they have a certain autonomy.
Both Michael and Christine say they tried to raise concerns about Jason throughout his time in care, how he'd gained weight, was depressed and didn't need his medication, but they were ignored.
I couldn't have screamed or shouted louder. And when you're talking to so-called professionals, you're talking to a brick wall. They know best.
Hampshire County Council, which was in charge of Jason's community care, told us finding the right support for a person with complex mental health needs can be challenging, and they're working with the NHS to improve the help available in their area. Last year, a Sky News investigation found 40 people with a learning disability or autism had died while in secure hospitals between 2015 and 2018. We now know Jason was one of them. And since then, we can reveal 10 further people have died in these specialist units in the last year.
This is a scandal that is continuing. There is abuse in these institutions. There's a continuing overuse of physical restraint, over-medication and seclusion. And the fact that there have been a further 10 deaths and that no one is owning up to the problem and saying we are going to sort it is the shocking thing for me.
The Department of Health and Social Care told Sky News they're determined to reduce the number of people with autism or learning disabilities in mental health hospitals and have invested significantly in community care. While NHS England added that in all cases appropriate processes have been followed to ensure local services make the necessary improvements. And in light of our report, they've arranged to meet Jason's parents. The Huntercombe Group, which runs the hospital where Jason was held, said since Mr Thompson's tragic death, we've taken extensive steps based on our own investigation efforts to mitigate the risks posed by button batteries. We remain fully committed to improving our practices. But Jason's parents are calling for action from the very top.
We on the ground can only do so much. What we've got to do is highlight the problems. And if we don't highlight the problems, nothing's going to be done anyway. But I'd really like to meet the Health Minister. Face-to-face with the Health Minister. Get answers from him.
Jason's parents don't just blame the hospital for his death. They say it was the entire care system which let their son down. At home with his family, Jason was happy and content, but he grew to become a man they barely recognised. Charlotte Lomas, Sky News.
And in response to that report, the Department of Health have released a statement and it says this: we are determined to reduce the number of people with autism or learning disabilities in mental health hospitals. Significant investment in community support has already led to a 23% reduction, and we are determined to go further. It continues. The NHS will reduce inpatient numbers by 35% by next year, and through the long-term plan, we will reduce numbers even further by investing in specialist services and community crisis care and giving local areas greater control of their budgets to reduce avoidable admissions and enable shorter lengths of stay.